Joining us live this morning, my good friend, Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital. Dr. Joe's been part of this morning show for over 30 years with great sports medicine advice, intel, and education. Dr. Joe, where are you going today?
Ouch. Wow, that's a long time, Ray. But I have to tell you that after last week, I have some friends and people listen to the show. They say, wow, you were fired up last week and gushing about things. And the new technology of things really does excite me. And so I have to say, seeing some of the technology that's going to be available in sports medicine for some of my friends and stuff, the Browns training facility was really cool. And today, I guess I'm at the stage in my career that's kind of a really fun stage. I'm going to get to go out to NeilMed, and I'm going to be a judge for the medical students work all year on projects. They call it From Bench to Bedside. And at NeilMed, these groups of students and engineers and others kind of come up with things that maybe make life easier in the medical world. And there's a couple of really cool ideas that they came up with. I can't wait to see them myself later this afternoon. So that's kind of the stage I'm at. Is futuristic stuff is really cool, but you know me better, too. You know I like to go backwards, too, and I like the past a lot, and I bring you with me back to the past because you're not that much younger than me. But looking back, you know, I had a meeting kind of talking with some of the people from the best sports medicine team around that I've been fortunate to be a part of and help, bring together a little bit. Obviously, it got a lot stronger when they started to push me to the side, but our sports medicine team, I talked to a lot of people on the team, and we were looking the other way at, hey, looking back over the last, for a lot of us, 25, 30, 35 years, what do you think are some of the biggest advances in sports medicine and sports rehab and diagnostics and life-saving techniques that we've had the benefit of that just burst upon the scene and really helped us? And there's a bunch, and I might go over a couple of these in the next couple of weeks, but the one that just stood out to most everybody was when especially for those of us on the sidelines, Ray, and taking care of kids on the sidelines, was the AED, the automated external defibrillator, the portable life-saving device. It delivers that electrical shock to restore normal rhythm and save lives. It restarts the heart. And a lot of these people, different heart problems, the most common one, hypertrophic cardiomyopathy, you and I have talked ad nauseum and through the years, and unfortunately when some of these cases occur, but the AED made a huge difference. I mean, I think it was a reason why a lot of people just didn't want to cover on the sidelines, or it made us uncomfortable, because we knew in the 80s and 90s we still didn't have a way to save a life if somebody went into these abnormal rhythms, because by the time we'd call a squad, it was often too late, or if we started CPR, totally very ineffective. Less than 5 to 10% of people that could we save with just CPR. And so what happened is these units that are now AEDs were these bulky hospital-bound units that they would, bring off of an ambulance, and most of them were used by ambulance from 1950s through the 60s, 70s, 80s still when I was on the field, and still in the 90s. Then there started to be some talk in the late 80s and the 90s of that they could come up with these units that would be portable, that could be used on the sidelines. And so these portable units started coming out in the 1990s, and we started to use them about 35 years ago. And historically that it was frightening. I mean, there were players, and we remember, because it goes back a ways, like Hank Gathers, a great basketball player from Loyola Marymount, Reggie Lewis, Flo Hyman, the great volleyball player, Chuck Hughes, Pete Maravich, many people who we just couldn't save, and they passed away playing sports. And so we started saving lives in the 2000s. Really cool. And so just the most recent ones who come to mind, people like DeMar Hamlin, the question was like Bronny James, but also we could go through so many kids here locally who I remember back to the 80s and 90s who we didn't get to in time and passed away playing sports. And now there's so many stories into the 2000s where we were able to save lives. When we get these AEDs and put them on and use them properly in the first 5 to 10 minutes, there's an 85 to 90% success rate in saving these people, these kids. And so of all the advances, that was really one of the coolest advances. And then we started in the 90s, and we'd have maybe one at a school, and that didn't work great. They'd put it outside the office, but on the weekends when sports would be going on and stuff. So they started to improve the technology, and we got more of these. At a place like our place at Sports Medicine Center with 38 high schools, we have about 5 to 10 of them at all of our high schools. I called our trainer yesterday, our head trainer who oversees this, and I was really so happy, even all the city schools and everything. We have them in the gyms. We have them outside. The athletic trainers carry them around with them, and we save a lot of lives with these. So it's really, really cool. There's one new unit that came out in late 2022 that's really cool. It's called a Vive. And this little unit is about the size of your cell phone, just a little bigger than your cell phone. And it's only about 2 pounds, Ray, and it actually has a GPS on it. So immediately when you start to prepare it to put it on, it calls the squad. So the squad will be there by the time we are beginning to try to shock people for further ability to save lives. And this is called an Abide unit. So there's a whole bunch of units out there that work. But I'm here to tell you that when advances like that go on over a 20, 30, 40-year career and you see it saving lives, this was probably one of the best pieces, best tools, best techniques that was out there that made me feel good in our career was the development of the AED.
Well, and Joe, I know you have done a great job with awareness and education. I remember going back and doing education videos here in the Akron area with Dr. Terry Gordon, who led a big charge with the AEDs and trying to make sure that people understood the significance and the impact that they could have at arenas, at football fields, and different schools.
Thanks for bringing up Terry Gordon. What a great guy. And you know what? I mean, a lot of doctors love it, and they're staying in the hospital a lot. A lot of people get outside and they do stuff. Terry did not mind going anywhere around town to try to do things that he knew could save lives. And so it's people like that that get me fired up. And there's a lot of great technology. We'll see some cool tools and technology today, too, and we'll continue to report on them to your audience. But it's also good to look back, and AEDs were just a really great advance in the field of sports medicine.
No doubt about it. Great show, Joe. Thank you for the time and really the background check and looking into it for us. Well done again, my friend, as always. We'll do it again next week.
Thanks, Ray. Have a great week.
You too, my friend. Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital, with us live this morning